Hi, my name is Bonnie Ann Henderson, and I'm a Dartmouth class of '89 and a med school Geisel class of '93. First, I just want to say congratulations for starting an ophthalmology residency program. I think that is great for you residents, but also really wonderful for the community at large. Second, I want to say thank you to Doctors Janine Eagle, Michael Zegans, and Donald Miller for inviting me to the Grand Rounds. It's an honor to be a part of this inaugural program. So what do I wish I had known as a resident? So first, listen to your mothers. Your mothers are always right. So kidding aside, I think the first thing that amazed me after residency was that most doctors' practice patterns don't change much after residency. So in other words, what you learn in residency is most likely how you'll be practicing for the rest of your career. So the way you perform lasers, surgery, how you even approach a diagnosis is oftentimes what you learned in residency. And it's true, new medications, new devices will be introduced and you will learn to use them. However, most doctors follow the patterns that they were taught in training. So what that means for you residents is that while you're in training, make sure you learn as much as you can, not just the basics of ophthalmology, but ask lots of questions to your mentors. Ask why they do what they do, how they think, and also what they do when they run into problems. Number two, you have a lot of free time right now. I know that sounds crazy, right? You're really busy in residency. You probably feel like you don't have time for anything. But in fact, you're going to have less time later. So life becomes even busier after residency. So now is the time, besides learning ophthalmology, to pursue other interests, whether it's research in ophthalmology or outside hobbies or even life goals. Don't stop your life because you're a resident. Number three, you will make mistakes, sometimes even big ones, and own up to them when you make a mistake. Learn from them, and these mistakes and how you handle them may be the best opportunities for you to learn about medicine, patient care, and actually most importantly, how you learn about yourself and how you handle complications, problems, and stressful situations. Number four, you're going to learn that half your patients or more are crazy or they're unrealistic. I know that sounds really silly, but in residency and before, I had assumed that most people are rational, logical people. But what I discovered is that's not necessarily always true. I'm amazed at how people think or at their expectations. And some patients will be angry or unhappy about their patient care that they receive, but whether they're unhappy about their wait time or their process or their interactions with their care providers, most of the time it's not your fault. But regardless, you will have your fair share of unhappy patients and unpleasant interactions, even if you deliver perfect care. So be prepared for these interactions, learn how to manage them professionally. Number five, I wish I had learned more practical tips for life. So not just ophthalmology in residency, but also financial aspects of how to deal with your career. So learn how to invest, how to plan for your future children's education, how to plan for retirement. So make sure when you have your attendings there, pick their brains about how they structured their lives outside of their kind of day-to-day career life, but really how do they handle and manage both their career life and their personal life and their goals for the future. And then last, and probably most importantly, be kind to your people in your life and to your patients. So in residency, you're sleep deprived, you're stressed and overwhelmed with the demands of residency. And it's really easy to be impatient or short with people around you, whether it's your loved ones or people at your work, and especially patients. Oftentimes they're elderly, they have difficulty understanding healthcare, they don't follow instructions. But, think of these people as your elderly grandparents and give them the extra TLC that they need. So I hope these few tips have been helpful, and I wish you the best of luck in a fulfilling and successful career as an ophthalmologist. I think you picked the right field. It's a wonderful field, and I wish you all the best.